Welcome back to part 2 of chapter 19 lecture. And we were talking about our 19.2 learning objectives. So discuss the management of fractures and prepare for and assist with both the application and removal of a cast. Summarize patient education guidelines for orthopedic patients and discuss the legal and ethical implications in an orthopedic practice. So here we see a sample of dislocation, and this is shown in your book in figure 1911, and this is the shoulder. A condition in which two bones of a joint are no longer in approximation is a dislocation. With dislocation, you may see pain, swelling, loss of motion, and sometimes temporary paralysis of the affected part. A dislocation requires immediate reduction and immobilization to prevent permanent injury to nerves and the major blood vessels near the joint. Gout. We talked about gout in our pharmacology lectures as well, but gout is a metabolic disease involving overproduction or improper elimination of uric acid. Uric acid is not effectively excreted, and a needle-like crystal or uric acid collect in the synovial fluid of the affected joint. This causes sensitivity to touch, it causes inflammation, and also very severe pain. Risk factors for gout include alcohol, obesity, untreated hypertension, diabetes, hypercholesterolemia, and family history of the disease. Long-range treatment includes dietary modifications to eliminate foods containing purine. Purines are a natural substance found in some foods, and when your body digests the purine, it produces a waste product called uric acid. So you can see how that would help to reduce that if you were having gout. For treatment of an acute onset of inflammation, the patient may take nonsteroidal anti-inflammatory drugs, so NSAIDs, such as ibuprofen and naproxen for pain and joint inflammation. And the most frequent affected area for gout is the great toe, so the big toe. Let's look now at lupus. There are three main types of lupus. So systemic lupus erythematosus, also abbreviated SLE, discoid lupus erythematosus, and drug-induced lupus. SLE is an autoimmune disease of unknown cause, and it is difficult to diagnose. The patient develops antibodies, and these antibodies can attack itself and any tissue or organ in the body. The disease can come and go into remission, and it's treated individually to maintain patient function. And I think I've shared this with you before, but I have been, as well as my mother, have been diagnosed with lupus, and management for lupus for me specifically has been to reduce stress in any way possible, completely change eating habits, meditation, exercise, and really taking care of the body as much as possible. And I do notice that when I get run down, I immediately have things that my body shows me and reminds me that it might want to kick in and start to fight itself. So it is manageable, but it can be more serious, and the kidneys may fail even with treatment. So there might be a necessity for kidney dialysis or kidney transplant if the kidneys are affected. Here is criteria for diagnosing systemic lupus, and this is, as the previous slide said, very difficult and can take a long time. The providers use this American College 11 criteria of lupus to help diagnose systemic lupus, or SLE, and you can take a look at your book and look at this more closely. Infectious arthritis. So infectious arthritis occurs after some type of systemic or local infection in some other part of the body or after a joint has been violated by trauma or by surgery. Severe inflammation and significantly reduced range of motion occur. Goals of treatment are to reduce the inflammation, increase the range of motion, and to treat the causative organism. How do you think that a diagnosis here is determined? So to determine the diagnosis for the infectious arthritis, the provider may order an X-ray evaluation and a bone scan, and the physician may withdraw some synovial fluid for microscopic examination and culture. Lyme disease. Lyme disease is an infection caused by a bacteria. It's transmitted by a tick bite. There is a bullseye lesion, flu-like symptoms, and pain in multiple joints. Diagnosis through careful history and lab tests are how you can confirm Lyme disease, and typically antibiotics are used for treatment. The tests are most reliable a few weeks after an infection because it takes some time for the antibodies to develop. So it does, if you do it right when the tick is found and removed, you don't get as reliable as a test as if it's done a couple weeks down the road. So patient education for preventing Lyme disease. Wear pants tucked into socks and long sleeve shirts when you're in nature and hiking. Even in your backyards where I live, we have lots of ticks because we have a lot of property and you're walking down through there. Use insect repellents containing DEET. Tick-proof your yard, which is impossible where I live because we have tons and tons of deer running through our yard. Remove brush and leaves from your yard. Check yourself, your children, and pets for ticks and shower after outdoor activities. Remove the ticks with tweezers by grasping near the head and immediately apply antiseptic to the bitten area. It is possible to catch Lyme disease more than once, so do not assume you're immune. If you've had Lyme disease, you can get it more than once. If you develop a rash or fever within several weeks of removing a tick, it's important to see the healthcare provider. So, degenerate joint disease, DJD, osteoarthritis. There's significant thinning and degeneration of the articular cartilage and the synovial joints. A roughened surface of the bone is exposed, leaving the bone rubbing against bone. So this causes obviously pain if you can imagine bone rubbing against bone, and it also causes stiffness of the involved joints. Diagnosis frequently includes an X-ray. Treatment goals are to reduce pain, maintain normal motion, prevent any deformities, and the medications include analgesics, NSAIDs, and steroid injections. Commonly affected joints involve and include the fingers, the spine, and weight-bearing joints of the hips, knees, and feet. It's important to note that using a walker or a cane may be helpful for maintaining mobility in times with this joint disease. Severe cases can require surgery to remove the affected joint and replace it with a prosthetic joint. Rheumatoid arthritis, so this is also an autoimmune inflammatory condition that involves an immune system response to synovial membranes, causing synovitis, resulting in deformity and pain. It's probably triggered by an infection in people with genetic predisposition, and symptoms include malaise, fever, weight loss, and stiffness in the morning of these affected joints. We treat by rest, exercise, NSAIDs, and corticosteroids. Patients with rheumatoid arthritis, also known as RA, may appear undernourished and chronically ill because of the formation of the degenerative lesions in the collagen, so the connective tissues in the lungs, heart, blood vessels, and pleura. And you can see figure 19.3 shown signs and symptoms of rheumatoid arthritis. I know that you can't view it very well here, but it's it's not 19.3, it's 19.13 in your book. You can take a look. Tendinitis and bursitis. Tendinitis is the most common cause of pain in shoulder and elbow and can lead to calcium deposits in bursae around the joints, and this causes bursitis. Treatment includes pain relief and reducing inflammation. So bursitis is defined as painful inflammation of joints, bursa that most commonly follows a repetitive movement or prolonged pressure on a joint. Carpal tunnel syndrome. Carpal tunnel syndrome results from a combination of factors that increase pressure on the median nerve and tendons in the carpal tunnel. Contributing factors include trauma or injury to the wrist, hypothyroidism, rheumatoid arthritis, work stress, repeated use of vibrating hand tools, fluid retention during pregnancy or menopause, or development of cyst or tumor in the canal. A complete physical examination and routine laboratory tests are needed to rule out diabetes, arthritis, and fractures. And the initial treatment here, recommendations are to rest the hand and wrist for at least 2 weeks. And then once symptoms have been relieved, physical therapy is done to promote stretching and strengthening. And this can also happen in things such as repeated motion. Example might be somebody who plays tennis often. So your role as a medical assistant in these orthopedic procedures, you record the patient's description of the problem and other details of history, record the exact location of the pain and have the patient quantify the pain on a scale of 1 to 10, ask about over-the-counter and prescription medications, offer assistance when escorting the patient to the examination room, and use a wheelchair if necessary. Assist the patient into a comfortable position and to undress if necessary, and explain clearly what the patient can expect. When you're assisting in the examination, demonstrate positions or movements patients need to assume, watch the patient for facial grimaces that indicate pain, take notes during the examination, keep the patients draped, and hand the provider necessary equipment, and definitely prevent the patient from falling. What will the provider use to examine the muscles in the joints? Well, the provider may use inspection, palpation, range of motion testing, and muscle testing to examine the major skeletal muscles and joints. Much of the examination involves comparing muscles and joints on the affected side with those of the counterlateral side. For size, we're looking at size, position, and strength. The provider performs a gait analysis by watching the patient walk in a straight line with or without the patient knowing he or she is being observed. So what is a range of motion evaluation? We just mentioned that in the last slide. It's an objective measure of both the seriousness of an injury and the recovery process. Joint movement in a single plane is measured with a goniometer. You may be asked to record the degrees of motion for active and/or passive range of motion for specific joints and to note any pain, tenderness, or crepitation during the examination. So what is a goniometer? A goniometer has 2 arms that are fixed together with a hinge joint at one end. Each of the arms is lined up with a bone on each side of the joint being tested. The degrees of motion are indicated on a scale on the hinge center of the instrument. And here is an example. You can find this in figure 19.14 in your book. Muscle strength evaluation. During a range of motion evaluation, the provider also assesses each muscle group for their strength. Normal muscle strength allows for complete voluntary range of motion despite resistance. And evaluation compares the like muscles in each hemisphere of the body. Muscle strength is bilaterally equal in normal conditions.